Deep within the heart of almost every cell in our bodies lies a microscopic instruction manual. This manual, composed of DNA, dictates everything about us: our hair color, our height, even our susceptibility to certain diseases. This DNA is meticulously organized into structures called chromosomes. We inherit 23 chromosomes from our mothers and 23 from our fathers, giving us a total of 46 chromosomes. These chromosomes are grouped into 23 pairs. Each chromosome carries thousands of genes, the basic units of heredity. Genes act like recipes, providing the cell with instructions to make proteins. Proteins are essential for building cells, fighting infections, and regulating body processes. Any deviation from the norm can lead to a variety of health problems known as chromosomal abnormalities or disorders. Chromosomal abnormalities are broadly classified into two categories: numerical and structural. Numerical aberrations involve a change in the number of chromosomes. This can occur due to errors during cell division, either in the formation of sperm or egg cells or during early fetal development.
The most common type of numerical aberration is aneuploidy, which refers to the presence of an extra or missing chromosome. When there is an extra chromosome, the condition is called trisomy. When a chromosome is missing, it is called monosomy. Some well-known chromosomal disorders such as Down syndrome, Turner syndrome, and Klinefelter syndrome are caused by numerical aberrations. These disorders can lead to a wide range of physical and intellectual disabilities. Numerical chromosomal aberrations refer to changes in the normal number of chromosomes, which can lead to various genetic disorders. These abnormalities can result from errors during cell division, particularly meiosis, leading to conditions that significantly impact the health and development of affected individuals. This overview focuses on several chromosomal disorders, including Jacob syndrome, Down syndrome, Batow syndrome, Edwards syndrome, Turner syndrome, Klinefelter syndrome, and Fragile X syndrome.
Jacob syndrome, also known as 47XYY syndrome, is a genetic condition that affects males. It is characterized by the presence of an extra Y chromosome in each cell. Instead of the typical 46XY karyotype, individuals with Jacob syndrome have a 47XYY karyotype. Most males with Jacob syndrome are unaware of their condition, as they often do not experience significant health problems. Some individuals may be taller than average and have mild learning difficulties. However, the vast majority of males with Jacob syndrome have normal intelligence and lead fulfilling lives. In the past, there were misconceptions about Jacob syndrome, with some studies suggesting a link to aggression and criminal behavior. These studies have been widely discredited, and it is now understood that Jacob syndrome does not increase an individual's predisposition to criminal activity. Diagnosis. Karyotyping. The definitive method for diagnosing Jacob syndrome is karyotyping, which reveals the presence of an extra Y chromosome, 47XYY. Prenatal testing, non-invasive prenatal testing, NIPT, can detect Y chromosome material in maternal blood, indicating a possible XYY condition. Treatment, educational support. Children may require special educational services to address learning disabilities. Psychological counseling, behavioral therapy may be beneficial for addressing social and emotional challenges. Hormonal treatment. In some cases, testosterone therapy may be considered if there are signs of hypergonadism. Down syndrome, the most common chromosomal disorder, arises from an extra copy of chromosome 21, hence its alternative name trisomy 21. This extra chromosome leads to a range of physical and intellectual developmental differences. Individuals with Down syndrome often share characteristic facial features, including a flattened facial profile and upward slanting eyes. The extra chromosome 21 also impacts cognitive development. Individuals with Down syndrome typically experience mild to moderate intellectual disabilities.
Early intervention programs, including speech therapy, physical therapy, and occupational therapy, play a crucial role in maximizing the potential of children with Down syndrome. These programs help them develop essential skills, improve their motor function, and enhance their communication abilities. The degree of intellectual disability varies greatly among individuals. Diagnosis: karyotyping. Confirmatory testing for Down syndrome involves karyotyping to identify the extra chromosome 21. Prenatal screening. Screening tests such as the first trimester combined test and second trimester quad screen can indicate risk, followed by diagnostic tests like amniocentesis or chorionic villus sampling, CVS. Treatment. Early intervention programs. Speech, occupational, and physical therapy are essential for developmental support. Regular health monitoring. Monitoring for associated conditions such as congenital heart defects, hypothyroidism, and hearing issues is crucial.
Patau syndrome, a rare chromosomal disorder, results from an extra copy of chromosome 13. This trisomy leads to severe intellectual disability and a multitude of physical abnormalities. Sadly, many infants with Patau syndrome do not survive past their first week of life. Infants born with Patau syndrome often present with serious birth defects, including heart defects and brain abnormalities. Due to the profound health challenges, treatment for Patau syndrome focuses on palliative care. This approach prioritizes managing symptoms, providing comfort, and improving the quality of life for the infant and their family. The decision to pursue aggressive medical interventions is made on a case-by-case basis. The profound impact of Patau syndrome underscores the delicate balance of our genetic makeup. Diagnosis: karyotyping. Diagnosis is confirmed through karyotyping, which shows an extra chromosome 13. Ultrasound. Prenatal ultrasound may reveal structural abnormalities suggestive of Patau syndrome. Treatment: palliative care. Due to the high mortality rate, treatment often focuses on comfort care rather than curative measures. Surgical interventions. In some cases, surgeries may be performed to correct life-threatening conditions, for example, congenital heart defects, but the prognosis remains poor. Edwards syndrome, another rare chromosomal disorder, arises from an extra copy of chromosome 18. Like Patau syndrome, Edwards syndrome causes significant developmental issues, leading to a range of physical abnormalities and a shortened lifespan. Infants with Edwards syndrome often have low birth weight, slow growth, and severe intellectual disability. Treatment for Edwards syndrome primarily focuses on supportive care. This includes providing nutritional support, managing respiratory issues, and addressing any other medical needs. The goal is to ensure the infant's comfort and to support the family during this challenging time. The rarity and severity of Edwards syndrome highlight the critical role of genetic counseling for families with a history of chromosomal disorders. Understanding the risks and options available can help families make informed decisions about family planning and prenatal testing. Molecular studies indicate that the overexpression of genes on chromosome 18 disrupts normal developmental pathways. Most affected infants do not survive beyond the first year, with only a small percentage living into early childhood. Diagnosis: karyotyping. Confirmatory diagnosis through karyotyping to identify the extra chromosome 18. Prenatal screening: ultrasound may indicate markers such as growth restriction or congenital anomalies. Treatment: palliative care. Like Patau syndrome, the focus is often on palliative care due to the severe prognosis. Supportive care: families may receive support from social services and counseling to navigate the challenges of caring for a child with significant health issues. Turner syndrome, a condition affecting only females, arises from a missing or incomplete X chromosome. Instead of the typical 2 X chromosomes, females with Turner syndrome have only one functional X chromosome. This missing genetic material leads to a variety of developmental challenges. One of the most noticeable characteristics of Turner syndrome is short stature. Girls with Turner syndrome are typically shorter than their peers and may not experience a growth spurt during puberty.
The missing X chromosome in Turner syndrome also impacts hormone production. Girls with this condition often experience delayed puberty and may not develop secondary sexual characteristics without hormone therapy. Treatment with growth hormone and estrogen can help improve height, stimulate puberty, and promote the development of secondary sexual characteristics. With support and medical care, girls and women with Turner syndrome can lead healthy and fulfilling lives. Molecular research has focused on the role of the SHOX gene, located on the X chromosome, which is crucial for skeletal development. Hormonal therapies and growth hormone treatments can improve outcomes for affected individuals. Diagnosis: karyotyping. Diagnosis is confirmed by karyotyping, which reveals the absence of one X chromosome, 45X. Ultrasound: prenatal ultrasound may detect cystic hygroma or other markers. Treatment: growth hormone therapy, administered to promote growth in childhood. Estrogen replacement therapy, initiated during puberty to develop secondary sexual characteristics and prevent osteoporosis. Fertility treatments. Options may include assisted reproductive technologies for women wishing to conceive.
Klinefelter syndrome arises from an extra X chromosome in males. Males with Klinefelter syndrome have an XXY configuration. This can lead to physical and developmental differences.
It significantly impacts sexual development, often resulting in smaller testes and lower testosterone levels. This can lead to delayed puberty and infertility. Treatment typically involves testosterone therapy. Therapy helps develop male characteristics and improve muscle mass. Molecular studies suggest that the additional X chromosome leads to abnormal gene expression patterns, particularly those related to sexual development and cognitive function. Testosterone replacement therapy can help manage symptoms. Diagnosis: karyotyping. Diagnosis is confirmed through karyotyping, which shows an extra X chromosome, 47XY. Hormonal assessments. Testosterone levels may be evaluated to assess for hypogonadism. Treatment: testosterone replacement therapy helps in developing secondary sexual characteristics and improving mood and energy levels. Fertility treatments. Options such as sperm extraction and assisted reproductive technologies may be available for men wishing to father children. Educational support. Addressing learning disabilities through special education services.
Diagnosing chromosomal disorders can occur at various stages of life, from prenatal screening during pregnancy to clinical evaluation after birth. Prenatal screening tests offered during pregnancy assess the risk of a fetus having a chromosomal abnormality. These tests, including blood tests and ultrasound examinations, don't provide a definitive diagnosis but can indicate the need for further testing. Diagnostic tests such as amniocentesis and chorionic villus sampling, or CVS, provide a definitive diagnosis. These procedures involve analyzing cells from the fetus to examine their chromosomes. After birth, a diagnosis of a chromosomal disorder is often suspected based on a child's physical characteristics, developmental delays, or other medical issues. A karyotype test, which analyzes an individual's chromosomes from a blood sample, confirms the diagnosis. Early diagnosis of chromosomal disorders is crucial as it allows for timely intervention and access to appropriate support services. Living with a chromosomal disorder presents unique challenges. With the right support, individuals can lead fulfilling lives.
Treatment varies by condition and symptoms. It may involve medical interventions, therapies, and educational support. Support groups connect families and provide resources. Educational support is crucial for children with chromosomal disorders. With early intervention and resources, individuals can overcome challenges. Fragile X syndrome diagnosis. Molecular genetic testing. The diagnosis is confirmed through DNA testing to identify the expansion of the FMR1 gene on the X chromosome. Family history. A detailed family history may be taken. as the condition is inherited in an X-linked manner. Treatment: educational interventions, tailored educational programs and therapies to address learning difficulties. Behavioral therapy, support for behavioral issues, including anxiety and attention deficits. Medications, antidepressants or stimulants may be prescribed to manage symptoms of anxiety and hyperactivity.
Consideration.